Dr. Piskin, I know you did talk to us a little bit about Invisalign and orthodontic in one of our interviews, but why don't you tell us, like, what is so different, and why does Invisalign, make such big waves and is so heavily used these days versus the normal orthodontic braces, the metal braces, the ceramic braces type of stuff?
Sure, I can give you some insight on that. A lot of the cases today are adults that had orthodontics as a kid, but didn't wear their retainers like they should have, or over time some of the teeth have shifted a little bit and they're unhappy with the bottom teeth. They have a little bit of crowding or overlap, and they want to straighten them out, but they don't want the conventional braces anymore, the wires, the brackets. So Invisalign is a product that is an aligner that is worn about 22 hours a day, and it's removable so that they can clean their teeth and do their oral hygiene, and also when they're eating. And it's invisible when you have it in, so you can go to work, no one's going to know that you have it, and you can literally realign those teeth the way you wanted them very easily with these types of retainers. And the large percentage are usually adults or young adults that have this type of relapse over time. It's an amazing product. It works very, very well, and most of the patients are ecstatic that they don't have to have the brackets where all the food gets stuck underneath, and they can take it out to eat and to do their hygiene. So it's been around for a while, and it's very successful. And matter of fact, I have a brochure right here. And they can go on the website also. Invisalign has their own website, but it's an amazing thing, and it's called Invisalign.
And are those Invisaligns, those retainers, kind of, are they really quite as invisible as the name suggests?
They're made of a copolymer, and they're really totally clear.
Beautiful.
They fit unbelievably. They gradually, each 2-week period, you will use a new aligner, and they will gradually move the teeth to what has been decided at the beginning of the treatment as to what you would like to have done. And some cases it might be done in a month or two. In some cases it might take a year. Depends upon how crowded your teeth are. But for those clients and patients that want to have straight teeth, that don't want the brackets, it's truly a remarkable product. So we do a lot of Invisalign here in the office, and you can do it on anybody around 15 years old or up. They have to have their second adult molars in, which come in around 12 to 13 years old. And as long as they have those teeth erupted, you can use the Invisalign product.
Is that a difference from the normal braces for younger people, where that second molar doesn't have to be in? They can do their braces before that?
They can start their braces before, but you usually have to wait for those second molars to come in. That's why you'll see a lot of the kids around 13 years old. Those are the kids that you're usually seeing with the regular braces.
Okay, so it's pretty much the same. And one of the main reasons why not so many children at this moment are using it is because a matter of discipline. Children may have a tendency to take them out a little bit too much, and next thing you know is, it's like if you don't wear them, they don't do you any good. Is that kind of the main reason why it is sometimes yet not suggested for younger adults?
Well, the company says you have to have the second molars in, but the compliance issue is important. You know, kids today can be forgetful, and they can forget where they've left it. They left it on the counter, and they didn't remember, or the dog ate it, and they have to have really great compliance. But there's plenty of 14 and 15-year-olds that are great candidates for Invisalign, that are very good at taking care of themselves and are very compliant, and it would be a great option for them instead of the conventional braces.
I didn't know dogs ate Invisaligns. I thought they only eat homeworks.
They love everything. I have a couple of dogs. They'll eat anything that's not tied down.
All right. So let's just say the adult who takes the Invisalign and is for some reason still a little bit self-conscious, maybe at the beginning when he gets them. And he has that all-important date, that all-important job interview, whatever. And if he takes it out for an hour or so, that's all right, right? He can do that as long as he doesn't exaggerate and has 4 times a day an hour. He thinks it's important.
Exactly. You know, once in a blue moon, that's okay. So you wear it another hour longer that next day, or you catch up at the end. As long as you don't leave it out for long periods of time, because the teeth will kind of remember and they'll kind of move back. So for a short time, for an interview, special occasion, during the time you're eating and doing your oral hygiene. So, 21 hours, 22 hours, that's usually sufficient. So that's great. You can take it out.
Now, so obviously that Invisalign probably lends himself or itself also very, very well for adults who have that 1 or 2 crooked teeth in front, not super crooked, but crooked, and instead of flapping on a few veneers, lumineers, grinding down the teeth, basically hurting a perfectly good tooth otherwise, to straighten them out with those Invisalign seems to be a rather good method also, right?
It's always better to save your own tooth structure if you can, and so if you have a little overlap, a little crowding, the best choice, obviously, is always to straighten them, and the Invisalign is a great product to do that. It does it very quickly. There are patients that, have a lot of crowding and crookedness, but they also have a lot of broken down teeth in the front. So, there are times when Invisalign wouldn't be the best choice. Maybe
Sure.
veneers and crowns would work just as well to straighten them. But if you have your natural teeth, please, let's just use Invisalign. Get them straight, and then we can always do whitening at the same time. A lot of times with the Invisalign aligners, you can use a whitening product in the aligner at the same time you're aligning the teeth. So you're getting a double
2 for 1.
You're getting straight teeth and you're getting white teeth at the same time. What's better than that?
That's great.
And then when they're done, they're ecstatic.
Oh, wonderful. In fact, shed some light on my next question here. Some orthodontists, some dentists say with the regular braces and ceramic and all that, while they definitely have their, they worked well, they still work fine and all that. But let's talk about cleaning the teeth, which obviously with the Invisalign you take it out, so cleaning is very normal and very just normal, where with the braces it's a little more complicated. Not that it can't be done, but it is more complicated. Again, you get the slightly more sloppy guys like perhaps me, and I might not do such a good job. So what often happens is that dentists say, okay, we straightened the guy's teeth, but now he has periodontal disease and cavities like crazy, and now we need to start all over again. Where with Invisalign, even with children, with 13, 14-year-old children, as long as they're responsible, disciplined, and keep it in, seems to be a very good choice for that very reason. Is there some truth to that?
Well, they have to be very careful with regular orthodontics, whether adult or children, that they're immaculate in their hygiene. Because there's a lot of hardware to clean around, and there's more areas where the plaque can build up, and you leave plaque around these brackets, they're going to get cavities. The worst scenario is if you take the regular braces off of someone's teeth and they have little squares on their teeth where they have cavities or big white spots because they didn't clean it well. With Invisalign, it's not going to happen. There's not going to be that difficulty to do their oral hygiene, so it is a great aid for keeping the teeth from decaying and from having that possible breakdown of tooth enamel.
Beautiful.
From poor oral hygiene.
Yes, beautiful. And, it looks to me that is because obviously to a very high degree the reason dentists like you became so good in doing dental implants and dentures and import-supported dentures and all that type of stuff and crowns and bridges is probably because most of us have some type of shortage of dental hygiene, whether that is the brushing, the flossing, and whether that is the regular going to a dentist. That is why people lose teeth in the first place, because it's very preventable if people don't do that. So it's easy to assume that when you add such a handicap of having to floss and brush so tediously and so meticulously, that problems might occur. So it looks like for that, Invisalign seems to be another very good reason. Well, Dr. Piskin, thank you very, very much for your candid information. Bye-bye.
You're welcome.